So good. All right, in today's House Call segment, we are going to talk about something that you probably haven't heard of. It's a pain phenomenon called CRPS or RSD, and it usually is experienced after an injury. So Dr. Alex Bigham is a chiropractic physician, and he is the CEO of Novocur Pain Management Clinics, and he's here to shed some light on it for us. Now, welcome back to Sonoran Living, by the way.
Thank you.
I learned so much. We're always talking about things before we start the show. And this one, I mean, both you and I were just saying, count our blessings that we don't have this.
Oh, I know. This is going to be one of the most painful, one of the most debilitating pain syndromes that anybody can ever experience. A lot of these people have issues with depression, suicidal thoughts, because once they realize the gravity of this issue, it is depressing.
Well, tell me what it is. You said it typically happens after an accident.
Yeah, usually there's an initiating injury that starts this off, and usually it's relatively minor. They twisted their ankle, they have a little sprain strain injury on their wrist. But let's take an ankle injury, for example. They turn their ankle, they get a little swelling, they have some pain associated. Usually that takes, 3 weeks to resolve. And usually the injuries are treated with some type of immobilization. That's the other thing. A minor injury that's treated with some kind of immobilization.
So let's say
like
they have like a cast, okay.
Right. So the problem is, and here's one of the main symptoms in this picture, is that they begin to develop some severe swelling at some point during the course of this disease. And what happens is usually with an injury, pain is usually a good thing. Pain signals get sent to our brain perceives the pain, it tells us not to use that body part. It's a good warning signal, but at some point our brain starts to shut down those pain signals.
And we don't know why, it just happens.
Well, in this particular disease process, what happens is the brain doesn't shut down those pain signals. In fact, the pain signals become amplified and they get out of control. Then it begins to affect some of the sympathetic nerves. Our sympathetic nerves control a lot of blood vessels. They control a lot of issues with our skin, hair growth, nails, a lot of things like that. So we'll see issues of swelling, burning pain. We'll see initially the hair will grow more in the area that's affected.
And that's because of the lack of blood flow, because of the nerve?
Well, and it's because of the effect. It's because of the effect to the sympathetic nerves, which control those things. And so a lot of times there'll be profuse sweating in the area that's injured. And this cycle is kind of illustrated here. There's an initial injury. Pain signals are sent to the brain, and the brain is now affecting especially blood flow, skin, hair, nails. But eventually, this becomes to the point where, because they don't use the limb, whether it's the ankle or the wrist for so long, they begin to get muscle wasting. They begin to get bone demineralization. They become completely disabled, where the point where, if it's a leg injury, they may have to use crutches, they may be in a wheelchair. Sometimes it begins to affect the other leg that wasn't even initially injured. In fact, it can affect any part in your body, your nose, an internal organ.
And it's
pretty
ridiculous. Soon, can you just...
It can feel like it's body-wide.
Right.
And the pain is intense. I've heard some patients describe it as, it feels like a burning hot corkscrew is drilling into my bones.
Okay, so how do you diagnose it?
Yeah, okay, this is a difficult diagnosis, and early diagnosis is key. The sooner we jump on this problem with appropriate treatment, the better. And so really, we're ruling out a lot of the other issues. And a lot of times there is a slight nerve injury involved, so a lot of times we're going to do diagnostics where we're evaluating nerve function, like nerve conduction velocity tests or EMG studies. But a lot of it is just proper history, proper physical exam, understanding what the symptoms are, and ruling out other disease processes.
Okay, big question. We're diagnosing it, now we need to treat it.
Right. Okay, so there's a lot of different medications that we're going to initially try, and if those fail, we're going to do usually some type of injectable treatments in an attempt to try and calm down this sympathetic reflex type response. Their brain is actually changing. The way their brain functions is changing. They call that neuroplastic changes to the brain. You can see it on an MRI. It's functioning differently, and we have to break the pain cycle so that their brain starts to function better again. Once medications and injections have failed, then our doctors at Novocur Pain Management Clinics, the anesthesiologists who are pain specialists that we have, are going to usually do something like a spinal cord stimulator. This is going to work for about 60% of these patients. And what happens is we are basically bombarding their spinal cord with signals, a signal better than pain.
From that thing that we
little
saw,
device right
okay.
there, and that is going to block the pain signals from getting to their brain. It also is going to help improve blood flow. These people, let's say it's a wrist that's been injured. Eventually, their wrist is non-functional. It's curled up into a ball. The skin becomes white, the skin becomes thin, they lose the hair on it, they can't use it. And here's a before and after picture of actually, this is the same patient.
It doesn't even look like the same
a spinal cord
person.
Stimulator, right. And you can see the improvement in the swelling, the coloration, the skin looks more normal. This is the answer for a lot of these people.
Okay, well, let's go ahead and tell everybody how they can see you, and then we're going to ask some questions or have folks ask their questions.
Okay.
All right, so Novocur Pain Management Clinics, they have 2 locations in the Valley, and for more information, you can visit Novocur.com, or you can call them at 480-855-NOVO, which is 480-855-6686. Okay, if you have a question about CRPS or RSD, let us know. You might not even know that that's what you have. Head to SonoranLiving.com right now and then click on House Calls on the right side of the page, and then the doctor will be here. He is going to be here throughout the show answering your questions and to hopefully help get you in there so you can start to feel better really, really soon.